Hi, I'm Dr. Andrew Softley, and I'd like to talk to you today about why it's important to floss your teeth. I've seen a lot of material telling us how best to floss our teeth, but not a lot telling you why dentists want you to floss. There's two main reasons. The first is to keep the gums healthy and preserve the bone that supports the teeth, and that's extremely important. But what I'd like to talk to you about today is flossing to prevent cavities from forming in between your teeth, places that your toothbrush just can't reach. I'd like to show you some x-rays and some photographs and show you what decay actually looks like in between your teeth from not doing a good job flossing. Alright, so using this plastic model in my high-tech pointing device, pencil, I'd like to show you the area that I'm talking about. Not the biting surface of the teeth, which we call the occlusal. That's the area most people think about cavities. Or the outside, which we call the buccal, or the inside, which we call the lingual. I'm talking about this little gap right in between the teeth there. There's a little space down by the gum line called the gingival embrasure. And when you eat things, breads are great for this, they can get packed up in that little space, and they don't come out. Not with regular brushing. As you can see, using a regular toothbrush, if you brush the top of the tooth, you're not going to get it out. Brush the inside, you're not going to get it out. Brush the outside, you're not going to get it out. The only thing that's going to clean that area is using floss. Sometimes a toothpick can help, but floss is the best. Now let's switch to an x-ray taken of a person that has a cavity on the side of their tooth that they might have prevented by regular flossing. The cavity is right in this area, and it's that dark triangle you might be able to see. This is one of the things that a dentist looks for when we take regular x-rays. We want to try and find these cavities at the earliest stage possible so we can fix them before they get too large. This is just a way to highlight that area, and you can see the dark spot in the center of that circle. So when I actually worked on this patient, I stopped in the middle and I took a picture of what the cavity looked like. And there it is. This is the same tooth that we just had the x-ray of, showing you what the cavity looks like in between your teeth. Now, if you look at the top of the tooth, you don't see any cavity, everything looks great. And even on the side of the tooth next to it, everything looks fine. And that's what this tooth looked like before we removed a little bit of tooth structure and showed the area where the decay was in between. The white area is enamel that's been demineralized by food being caught right in between the teeth, right in that gingival embrasure, which is right there. And the bacteria catches that food, eats that food, and produces acid, which dissolves the tooth structure. And that's what you're looking at with this white demineralized enamel. The darker area is where the cavity has penetrated in through the enamel into the dentin, which is the next layer inside the tooth, which is much softer. Let's take a look at a couple other things. Here's another picture of a small cavity in between the teeth. This is a really small one, but you can see even this one reached up into the dentin there. And then let me show you what a cavity looks like in between the teeth that gets a little bit out of control. Same thing, different tooth, large cavity at this point. It originally started right here because food was getting caught right in this area and was not getting cleaned out with floss. Cavity started off small and eventually spread to be quite large. Well, hopefully that's helpful and informative, and it explains why you need to floss to prevent cavities from forming in between your teeth. Thanks. Bye.